Good evening, guys. So today I will be discussing the last part of the general anatomy, that is part seven. Virtual reality. Good evening, beta. So yes, this will be the last topic that I will be discussing with you guys today. Saurav Sanchu, hello, beta, hello. Yes, good evening, beta. I hope the audio and visuals are perfectly fine. So before starting the session, just give me a thumbs up in the chat box if the audio and visuals are perfectly fine. So yes, Saurav Sanju, perfect. What about rest, guys? What about rest? Yes, Pramod Patel. Very good evening, beta. Very good evening. Pradeep Raj Pandey. Good evening, beta. Good evening. Yes, I hope everything is fine from my end. Right? I'm audible. Yes, you can hear me. You can watch. Yes, chill. Perfect, guys. Chill. Yogesh Patil. Yes, it is Jai Shri Ram. Yes, love from England. Amazing. Perfect. Chill. Let us start with the topic for today, that is the bony markings. Naveen Yaduvanshi. Yes, I will be discussing the bony markings beta. I will be discussing the bursa and I will be discussing the types of ossification. Right? Yeah. Because of the presence of a pigment called myoglobin. Chalo. Anyways, yeah. Let us now start with the topic for today. Please, yes. Aortic arches, I will do in the upcoming sessions. No need to worry. Yeah, I will be coming to Almaty soon. I got the visa today for a change. Anyways, let us not discuss that today. Yeah. Now, bony markings, the very first topic that we are going to discuss over here. Yes, I will be starting upper limb. I will be waiting comments from your side, guys. You will be commenting in the chat box or in the comment section after the video which topic you guys want me to start next, right? So yes, already have told you this. So I will be starting the bony markings or the features of the bones. Now, guys, this is very important, guys. Now, why this topic is important? Because guys, whenever know as a first year MBBS student, you guys should know how to describe a bone. Now, you guys, if you don't know what is a ridge, what is a pit, what is a head, what is a condyle, what is epicondyle, what is fissure, if you don't know these terms, guys, then there is no point. Otherwise, you guys will start cramming all the things. So just to avoid cramming, right? To just ratify all the things, better understand it conceptually. One lecture, if you give on this, the bony markings, which is I'll just cover in very short. All the bones, all the parts of the bones in the upcoming lectures will become very easy. It will become a piece of cake. No one will teach you this because they believe that you guys know this. But I personally believe, guys, that you should be taught each and everything. Whether, see, this part will not be asked in the exam, but yeah, this is the basics, right? If you don't know it, the upcoming parts you will not be able to know. You will start cramming it, or usko you will be like forgetting it after a span of time. So always I tell you guys, to understand and then memorize the things. It's just not no, you have to ratify, right? Yes. So yes, I will be starting with the upper limb. Let us just finish this. The bony markings, guys. Now, the bony markings are classified into four types majorly, guys. The four types that you have to remember in broad headings. Yeah, the four types that you guys have to remember in broad headings. The very first one, that is the articular surfaces. Articular surfaces. Now, when I say articular surfaces, guys, you guys already know it is the part of the bone that is involved in the formation of the joint. Joint का मतलब क्या होता है? दो bone का आपस में मिलना. Articular means it is that part or that region of the bone which is involved in the formation of joint. So it can be of various types. I will be discussing it in detail. Sabrina Mohabbati, hello, beta. Hello. The second one, beta. The second one, it is called as the bony elevations. The bony elevations. The bony elevations, right? some part of the bone it is coming out. It can be in the form of like it can be sharp, right? It can be sharp, it can be linear, okay, and it can be rounded also. It can be rounded also. No need to worry, just try to make the flowchart along with me, then I will take one by one each particular marking separately, right? So yes, the third one, it is the bony depression, guys. The third one, it is the bony depression. The bony depression, guys. The bony depression, right? The depressions. We have certain depressions in the bone. We will be discussing that. And the fourth one, guys, that is the perforations. That is the perforations in the bone. That is the perforations in the bone. So bony markings I have classified into four types: articular, bony elevation, bony depression. Elevation मतलब उठा हुआ, depression मतलब okay, and we have perforations, right? So yes. Now let us now start with the very first one, that is the articular surfaces. That is the articular surfaces. Now, now when I say articular surfaces, guys, you have to remember two things over here. Firstly, you should know that it is a smooth bony impression, right? This part of the bone, it is very smooth. It is a smooth bony impression, right? Which is covered by, okay. Now you already know the articular surface, it is covered by which cartilage, guys? Okay, again try to write in the chat box, guys. The articular cartilage, it is covered by which cartilage? I mean the, okay, I've already told it. Yes, it is the articular cartilage. Yes, you guys are right. Yes, Sabrina, very good. Amina, huh. Virtual reality, very good, beta. Yes, Dr. Kishore, hello, beta. Yes, it is covered by the articular cartilage, right? It is covered by articular cartilage, or also called as the hyaline cartilage. Okay, it is covered by the articular cartilage or the hyaline cartilage. Very good, right? And this part also enters the formation of a synovial joint, right? Pradeep Raj Pandey, very good. Aman, hello. Hino Kauser, very good, beta. Now, guys, articular surfaces can have various forms. Very important. Articular surfaces, yes, includes the following forms. Now, this is something that you have to remember, that you will find in each and every bone. The bones will become very easy, guys. No one will teach you the bones, I'm telling you. I have never taught this, right? I've never taught this, guys. So articular surfaces will include the following forms. So guys, I'm telling you this, bone markings आपको आनी चाहिए. It will make the bones very easy, right? अपन एक बार देखो अगर तुमने ये पढ़ा हुआ है. Now, the very first one over here, it can take the form of a head. Now, when I say head, beta, head का shape क्या होता है? You guys already know it is hemispherical, right? You can always say that head, it is a hemispherical articular surface. Hemispherical articular surface. Now, guys, obviously everyone has seen a ball, right? Everyone has seen a Costco ball or any ball, a leather ball, no, which is used while playing cricket. Now, this is a shape of a sphere. This is a shape of a sphere. Now, if I cut this sphere into half, then the appearance would be like this, right? Then the appearance would be like this. Now, this is called as hemisphere. This is hemi means half of the sphere. It is called hemisphere, and that is something which is called as the head. That is something which is called as the head. And guys, you already know the examples. Can anyone tell me the examples in which bones you will find the head? Head of, chalo, come on, guys. Tell the examples, guys. Yes, head of, yes, virtual reality, very good, beta. We have the head of the humerus. If you can just see, beta, that this is the humerus bone, and You are watching the humerus from the front. So this is the anterior view. Anterior का मतलब होता है आगे की तरफ. You are watching the humerus from the front. Yes, you guys are right. Sabrina Mohapati, Virtual, Hina Kausar, Samuel, Saurav, Amina. Yeah. Now you guys can very well see that this head, it is hemispherical in shape, right? If you can just point it out, and this is covered with the articular cartilage, or yeah, the hyaline cartilage. It is called as the head of the, yes, humerus. Head of the humerus, right? The second one, beta. Okay, can anyone identify which bone is this? The second one where I have put a question mark, guys. Yes, can anyone identify which bone is this? Yes, you should know this bone, guys. Yeah, just by looking at the bone, this is the anterior view. Yes, virtual reality, Sabrina, very good, beta. It is the femur bone. So in the anterior view, you can very well see that this is the femur bone, right? And in the femur also, you will see this half shaped, right? This is half shaped. Yes, Samuel, yes. Hina Passer, very good. Amina, beta, this is the femur bone. And you can see this hemispherical structure. And this is called as the head of the femur. Head of the femur. The femur, it is the longest bone, right? The longest bone, right? So this is the femur, head of the femur. Now, I hope the head is clear. The second one, the second category, okay, the second category over here, guys, it is condyle. It is condyle. Now, what is a condyle, guys? Now, what is a condyle? Now, when I say condyle, guys, remember, condyle are always rounded. So it is the rounded articular surface, okay, rounded articular surface at one end of the bone. Yes, at one end of the bone. Again, very, very important. Even the head, it is also hemispherical articular surface at one end of the bone, right? At one end. So see, obviously the head, the condyles, they will be present at the ends only because these are the parts which will form the joint. These are the parts which will participate in the joint formation. Obviously bone के बीच में तो कहीं पे मुझे condyle नहीं दिखेगा. Bone के बीच में तो कहीं पर मुझे head नजर नहीं आएगा. They will always be present at the end. So we have seen the head of the humerus, head of the femur. Now let us see the condyles of the femur, right? The condyles of the femur. I hope you can very well appreciate, guys, that this is the patella bone. This is the patella bone, right? This is the femur. This is the femur. This is the tibia. And we have the fibula. We have the fibula. Now you can see these rounded appearances, guys. I hope everyone can appreciate these rounded projections, right? These are covered, right? I hope everyone can see over here. These yellow colored, these blue colored, they are actually covered. These rounded projections. These are called as condyles. These are called as condyles. Now, assuming it in the normal, yes, yes, Pradeep Raj, you are very much right. Assuming it in the normal anatomical position, can anyone tell me which condyle it will be and which condyle it will be? Medial or lateral, guys? Now, comment. Sabrina, very good, beta. Yes, Anita, very good. Yes, this one will be the medial condyle, okay? Because you already know the midline, okay, you already know the midline of the body is somewhat here. So anything which is closer to the midline of the body, it is medial. So we have two condyles in the femur, the medial condyle and the lateral condyle. Condyle का मतलब और कुछ नहीं होता है. Yes, सौरभ संजू, हीना कौशल, you guys are right. Condyle का मतलब और कुछ नहीं होता है. It is the rounded articular part. Articular मतलब it will form the joint at one end of the bone, right? Now coming on to the next part, guys. Coming on to the next part, that is the third one, which will, yeah, that is the trochlea. Trochlea. Okay. Now trochlea is specifically a pulley shaped articular structure. A pulley shaped articular structure, right? A pulley shaped articular structure, right? So you guys can see over here as well. Now this is the lower end of the humerus, lower end of the humerus. And in this guys, you can very well see this pulley shaped structure. Yes, this pulley shaped structure which is going behind also. And you can see that it is blue in color, it is covered with articular cartilage. This is called as the trochlea. Okay, this is called as the trochlea. Now, guys, you already know this is the lower end of the humerus, and this is the anterior view. This is the anterior view, and this is the posterior view. You are watching the humerus from the front in this diagram and from behind in this particular diagram. Now you can very well see in the normal anatomical position, the trochlea will join with which bone? ह्यूमरस के नीचे कौन सी बोन प्रेजेंट होगी और ट्रोक्लिया के एग्जैक्ट नीचे कौन सी बोन आएगी? कम ऑन गाइस, कमेंट दिस इन द चैट बॉक्स. You should be knowing it. Yes, yes, अनीता वर्चुअल रियलिटी सब्रीना बेटा टिबिया कैसे आ सकती है? अल्लाह आएगी ना, अल्लाह आएगी बेटा. हसन यस हेलो yes beta it is Allah beta. If you just see over here, you can see the trochlea. I hope you can very well appreciate this trochlea over here. This is the trochlea and this is the normal anatomical position. If this is the normal anatomical position and suppose this is the midline of the body and suppose this is the midline of the body, so you can very well see that this particular ulna, yes, Hina Kausar, yes, Hassan, good evening, Samuel, yes, ulna, it is lying closer to the midline and trochlea is also medial. It is also medial. So trochlea will be joining with the trochlear notch of the ulna to form the elbow joint, right? Now coming on to the next one, guys, the next one, that is the capitulum. The fourth one over here that you have to remember, that is the capitulum. The capitulum, right? Now capitulum, it is a small spherical articular surface, a small spherical articular surface, a small spherical articular surface, right? Now capitulum is a small spherical, very small structure which you can just see over here, guys. Just lateral to the trochlea, this rounded structure. Okay, this is called as the capitulum. This is called as the capitulum. Now this capitulum, it will also form the joint. Now can anyone comment in the chat box to which bone the capitulum will join? To which bone the capitulum will join? Again, you can see in the picture also, this is the capitulum, right? And we have already discussed in the general anatomy. Yes, yes, Sabrina, very good, beta. It is the radius bone, guys. You can very well see this is the radius bone. So you can see that these parts are basically involved in the joint formation, even the head of the humerus. So, yes, I hope this is clear. Yes, Hina Kausar, Amina, yes, Anita, very good, beta, very good. So you can very well appreciate that capitulum, it is a small spherical articular surface, right? And now, in this case, the last one which is involved in formation of the joint, that is called as facet. बार बार facet सुना होगा. You have heard multiple times the word facet, guys. Now, what is facet, beta? Now, facet is basically a small, right? It is a small, flat, or I can simply say concave, right? It may be flat, it may be concave articular surface. It may be flat or it may be concave articular surface. It may be flat or it may be concave articular surface. Yes, guys. Hassan, yes, beta, you are right. Now, if you can just see over here, guys, this is which bone, guys? You already know this is the clavicle. This is the clavicle. Now, guys, you can see this is the acromial end of the clavicle. It will be joining with the acromion process, and you can see that we have a flat or we have a flat or concave. You can see this is a concave part. This is called as the facet. This is called as facet, beta, right? you can very well see this part, it is forming the joint, and I've already talked about this joint. Yeah, this is the acromioclavicular joint, right? This is the acromioclavicular joint, right? We have already talked about this in the previous sessions. So which part of the clavicle? You can see this is the facet, and facet is nothing but it is a linear, or you can say a concave depression, right? A flat or concave depression, right? So I hope this is clear. All the parts are clear, guys. What is head? What is condyle? What is trochlea? What is capitulum? What is facet? So the first part, that is the articular surfaces, are clear. Just give me a thumbs up in the chat box if this is clear to everyone. The articular surfaces are done. Yes, the articular surfaces are done. Yes, Sabrina, very good. Hina, very good. Right? Now, Hassan, yes. Now coming on to the next one, that is the bony deviations, guys. Coming on to the next one, that is the bony elevation. Sorry, पहले bony elevation करते, then we'll discuss the bony deviations. Yes, Anita. Yes, Nani. Very good. Now coming on to the bony elevations, you guys already know elevation means something coming out of the bone, right? So it can be classified into three types, guys. It is classified into three types. We have linear. Just try to make in the form of a flowchart, guys, so that it's very, very easy for you, right? It helps to reduce the friction, Amina. Now, now guys, we have three types of the bony elevations. We have three types. So remember, the very first type, we have the linear bony elevation. Then we have rounded bony elevation. And the third one, that is the sharp bony elevation. Sharp bony elevation. So we have three bony elevations: the linear bony elevation, yes, the rounded and the sharp. The rounded and the sharp. Now, the linear has three categories, guys. The linear has three categories. So remember, the very first one, it is called as the line, right? The line. Line is simple like this. Line is simple like this. You guys are going to tell me where we have used the word line. The second one, it is ridge. Ridge कह लो या border कह लो, one of the same things, guys. This ridge or border is nothing but it is यही line अगर थोड़ी सी thick हो जाए, if this line becomes a little bit thick, it is called as ridge. It is called as ridge. And the third one, guys, and the third one, it is called as the crest. The third one, it is called as the crest. Crest में क्या होता है, ये और ज्यादा thick हो जाता है. This becomes more thick, guys, right? This becomes more thick, right? So crest is thickened ridge or thickened border. Ridge को क्या बोलेंगे, वही लाइन जो thick हो जाए, ठीक है. क्रेस्ट को क्या बोलेंगे, वही रिच जो और थिक हो जाए, ठीक है, और मोटा हो जाए. सो that is called as the crest, right? Yes. Now, yes, Sabrina Mohabbati, very good, beta. Yes. Now, in the femur bone, guys, just if we just try to look at these parts over here, in the femur bone, guys, you can very well appreciate that we have a line over here. A simple line, if you can just appreciate, and this is called as the intertrochanteric line. Trochanteric line. Now there are two trochanters. We have the greater trochanter. I will be coming to these terms. No need to worry. We have the greater trochanter and we have the lesser trochanter. We have the lesser trochanter. Yes. The lesser trochanter, guys. You guys already know it is a line which is connecting the greater trochanter and the lesser trochanter anteriorly. And guys, the crest. इंटर का मतलब क्या हो गया, दो के बीच में, दो ट्रोकैंटर के बीच में. So it is just simple like a line. So intertrochanteric line, one of the example. Now guys, you have already discussed yes, you already know this is the iliac bone, right? Ilium, right? And over here you can see the border which is very thick over here. This is called as the iliac crest. Iliac crest. It is the ilium. It is a part of the hip bone. Ilium, ischium, and pubis. Ilium, ischium, and pubis. Yes. Anand Tiwari, very good. उभर. So ilium, iliac crest हो गया. ठीक है. Iliac crest का मतलब है वो border बहुत ज्यादा thick है. वो simple line नहीं है. वो बिल्कुल मोटी सी है. So that is the iliac crest. I hope this is clear to every one of you right now. I hope this is clear to every one of you. What is meant by the line, ridge, and the crest, right? Yes, Hassan, very good. What about rest, guys? Now, coming on to the next one, that is the rounded wala part. That is the rounded wala part. In the rounded wala part, we have four things that we have to remember. Okay, the bony elevations. The bony elevations. We have the fourth thing that you guys have to remember. Yes, the crest of the spine. We have multiple examples. I will be using the word crest, the ridge, the line multiple times, guys. So yes, don't worry, we'll be discussing each bone. For example, if I'm starting with the upper limb, I will be using all these terms. So that's why I'm just giving a very basic definition today so that it becomes a piece of cake when we discuss the bone, right? No one will teach you guys this, I'm telling you. It is assumed that you guys know this by birth, but I'm teaching it. Rounded में चार चीजें हो सकती हैं. So the very first one, we have the tubercle. We have tuberosity. The third one, we have trochanter. And I'll see it. And the fourth one, it is epicondyle. It is epicondyle. Now, when I say rounded, so it clearly means that all these, the tubercle, tuberosity, trochanter, epicondyle will be rounded in shape. Now, what is the difference? What is the difference? The difference is in the area, guys. Okay, in the shape, right? The tubercle, it is small like this. Okay, a small rounded projection. Tuberosity is a little bit large. Tuberosity is a little bit large. Trochanter, it is more large, right? Like this. And epicondyle, it is, epi means above. Condyle. So it is present above the condyles, right? We have the medial epicondyle and the lateral epicondyle. So tubercle means a very small rounded projection. Okay. Can anyone tell me the example for the tubercle? Can anyone tell me the example for the tubercle, guys? Right. Tubercle. In the, chalo, I'll just give an hint. We have done humerus. We have two tubercles in the humerus. Yes, Hina Kaushal, very good. Sabrina Mohabbati, very good. It is the, yes, you guys can very well see better. These are the small rounded projections which you can see over here. Right, this is the lesser tubercle of the humerus. Lesser tubercle of humerus. So tubercle is nothing but a rounded appearance which you can see over here. The rounded appearance which you can see over here. Lesser tubercle of the humerus. Lesser tubercle of the humerus, right? And we have this greater tubercle of the humerus. We have the greater tubercle of the humerus. Greater tubercle of the humerus. So we have the lesser tubercle of humerus and greater tubercle of the humerus. Yes, it is on the proximal end. Yeah, proximal मतलब ऊपर वाले end. Head के पास वाला है. Lesser है और greater tubercle है. And I have told you these are the sites for muscle insertions, right? These are the sites for the muscle insertion, guys. Very important, right? So you can see these rounded appearances. They are coming out. They are not going straight. It's just coming out. So these are small rounded elevations, right? So again, on the humerus bone, we have a deltoid tuberosity. A tuberosity is more big, right? Now coming on to the, yeah, the femur wala part, you can see the trochanter. Yes, the trochanter is irregular. No, the margins are very irregular, guys. Over here, it's a large area, right? It's rounded only, right? So yes, a trochanter is somewhat like that. The greater trochanter and the lesser trochanter of the femur. And guys, coming on to the epicondyle, guys, you already know. Yes, we have the yes, these rounded parts above the condyles. It is called as the medial epicondyle of the humerus, medial epicondyle of the humerus, and this is called as the lateral epicondyle of the humerus. Lateral epicondyle, just based on the place. If it is closer to the midline, we have the medial epicondyle and the lateral. Epi means condyle ke upar. Condyle ke upar. So we have the medial epicondyle and the lateral epicondyle of humerus. So that is about, yeah, that is about the trochanter, tuberosity, tubercle, and epicondyle. So I hope this is done, guys. I hope this is done. So you have understood the difference between the tubercle, tuberosity, trochanter, and epicondyle. Just give me a thumbs up in the chat box. Yes. Now coming on to the sharp wala part. Yeah. Coming on to the sharp wala part. Yes. In the sharp wala part, just try to remember two things, guys, over here. Yes, we have the spine. Yes, Sabrina, very good. Hina, very good. Yes, we have the spine. And secondly, it is the styloid process. Styloid process. Now, when I say spine, guys, it is a sharp projection. Right? When I say spine, beta, it is a sharp projection. Styloid process, it is actually the process which is seen in the radius and the ulna. If you guys can clearly see over here. Now, when I say process, guys, process का मतलब क्या होता है? Bony part which is coming out. Now this bony part, it is very very sharp. It is very very sharp. Now if you can just see, it might not be visible over here, but yeah, this part actually it's just behind that is the styloid process of the ulna. We have the styloid process of the radius as well, right? Styloid process. So that part of the bone which is coming out, elevation मतलब वही हो गया कि bone का वो वाला part जो बाहर आ रहा है, right? हेलो, डाट क्लास ले रहा हूँ मैं, नीचे लाइव हूँ मैं, कॉल कर देता हूँ, ठीक है? तो यस, sorry for the interruption, guys, right? So yes, we have the styloid process, right? So styloid process of ulna, styloid process of radius, right? So yes. Now, coming on to the next one, Yes, the bony elevations. I hope it is done, guys. I hope this is done. The radial tuberosity. Yes, you can. You are very much right, guys. If you want to see the radial tuberosity, I will show you. You can also see the radial tuberosity over here. If you can just make it out, guys. This is, yes, this is the rounded projection. Okay, which is more than a tubercle. And over here, multiple times the question has been asked, which muscle is inserted onto this radial tuberosity? Yes, that is the biceps brachii tendon. Radial tuberosity पे कौन सी मसल अटैच होती है? That is the biceps brachii tendon. Biceps brachii muscle की tendon अटैच होती है. Biceps brachii muscle की tendon अटैच होती है over here, right? So that is about, yeah, the, yes, the bony elevations, Now coming on to the next one, that is the bony depressions, guys. Coming on to the next one, that is the bony depressions. Now, in this case, guys, try to remember we have four types. We have pit or fovea. It is called as pit or fovea. We have a fossa. We have groove or sulcus. Groove or sulcus. Yes, and there is something called as the notch. So we have pit or fovea, the fossa, the groove or sulcus, and notch. Let us just try to understand this one by one. Now, pit or fovea. Remember, guys, the pit or fovea, it is a small depression. Okay, it is a small depression, right? Now, depression की बात करें, it is a very small depression. For example, this is the, okay, Now this is the head of the femur, and you guys will see, yes. So let us suppose that this is the head, and in the head part you will see a small depression that is called as the pit. That is called as the pit. Yes, 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 yes. Here the ligament attaches. Yes, you guys can see also if it's more posteriorly present. So yeah, we have a pit over here. Let me just show you. I don't think it's, yeah, it's not visible as such over here. More posteriorly it will be visible. So yes, we have the pit in the head of the femur. It is a very small depression. It is a very small depression, guys. Right? Second one, fossa. Remember, beta, the fossa, it is a large concave depression. A large concave depression. Very, very important. It is a large concave depression. The cranial fossa, beta, the olecranon fossa. Okay. Now, a large concave, cave जैसा depression बनेगा इसमें, cave जैसा depression है. For example, you can very well see one fossa. Okay. Let me just try to show you this fossa. Okay. Yes, can anyone identify this fossa? Which fossa? You can see a large depression on the posterior view of the humerus. In the posterior view, humerus के पीछे की तरफ trochlea के ऊपर. If you can just see, we above the trochlea, you can see, yes, spring hearts, very good. Yes, yes, yes. Sabrina, very good. We have the olecranon fossa. We have the olecranon fossa. Yes, right? We have the olecranon fossa, right? Now these fossas are basically meant for the lodging of the okay, for the ulnar का part जो है, basically the olecranon part will actually lodge into this. Okay, so yes, so remember, okay, so we have the olecranon fossa. Now, coming on to the groove or sulcus, so a large concave depression, can just write it over here that it is olecranon fossa. Okay, olecranon fossa. Hinopostyle, yes, it is right. Olecranon bursitis, yeah. Okay, we'll discuss the bursa also today. No need to worry. Groove or sulcus. With a groove or sulcus, it is a linear depression. It is a linear depression. Okay, so every time I'm using the same example, no, in the upper limb lectures also, it is intertubercular sulcus. Sorry guys, sorry. Or it is also called as the bicipital groove. Bicipital groove. Now, just try to look at this, guys. Just try to look at this picture of humerus. Now guys, you can see we have the lesser tubercle, we have the greater tubercle. Now in between the two mountains, in between the lesser tubercle and the greater tubercle, guys, you can see this yellow color depression. This yellow color, a linear depression you can see. It is in between the two, it is in between the two tubercles. So it is called as intertubercular sulcus. It is called as the intertubercular sulcus or intertubercular groove. Intertubercular groove. It is called as the intertubercular sulcus or intertubercular groove, guys, right? So yes, why it is called as the bicipital groove? Now, when I hope you have seen this image yesterday also, uh, over here, basically the biceps muscle is passing from above. So yes, that's why it is called as the bicipital groove also. It is called as the bicipital groove. So I hope this is clear to everyone that what is the groove or sulcus, right? What is groove or sulcus? That is a linear depression. Apart from that, guys, coming on to the notch. Notch, it is, yes, tendon head of the biceps basically run from this. And the notch part, beta, the notch part, remember, the notch, it is indented part of a bone, indented part of a bone, right? Now, for example, guys, you should remember we have intercondylar notch. intercondylar notch. Intercondylar notch. Now, guys, in the femur, guys, you can very well see we have multiple examples. Yes, Amora, very good. Spring Hearts, very good. Sabrina, very good. The intercondylar notch. Now, if we just try to look at this, I cannot show this picture is not like this. In between the condyles better. Let us suppose that this is the condyle and this is again a condyle. Right? We have condyle and we have condyle over here. So this is a depression, guys, in between the condyles. So this depression, it is called as intercondylar notch. Intercondylar notch. The indented part of the bone, which is going like behaving like a depression over here in between the condyles. And you can see this in the femur, the intercondylar notch. The intercondylar notch. Okay. So I hope this is clear. The bony depressions are clear to each one of you guys. Just give me a thumbs up in the chat box if this is clear to each one of you. Yes. Hina, Sabrina, Spring Hearts. Yes. What about wrist, guys? Coming on to the next part. Yeah. That is the perforation, guys. Perforations again are of three types. Yeah, the perforations again are of three types. That is a foramen. Yes, we have a canal and we have fissure. We have foramen, canal, and fissure. Yes, foramen, canal, and fissure. Now, foramen, you already remember when we were drawing the diagram for the nutrient, the long bone. I've already told you that there is a foramen called as the nutrient foramen. Foramen basically means a hole in the bone. Foramen basically means a hole in the bone. A hole in the bone. So example, you already know we have the nutrient foramen. We have the nutrient foramen. Right? We have the nutrient foramen. Right? In the long bones, you guys already know. Let us suppose that this is the long bone, and in the diaphysis, you will see a foramen through which the nutrient artery is entering into the bone. Right? So that is the nutrient foramen. Now, when I say canal, guys, canal, it is a long perforation in the bone. Okay, the long perforation in the bone. The long perforation in the bone. For example, if I say medullary canal, okay, long perforation in the bone. For example, if I say medullary canal, so you already know the medullary canal, it is running in the diaphysis, it is a long canal, right? So example, it is the medullary canal. Medullary canal, right? Now, the third one, that is the fissure. The third one, that is the fissure. It is a long, okay, or I can simply say a long cleft in a bone. Okay, ठीक है, एक बड़ी सी दरार जैसी देखने को मिलती है, long cleft in a bone, or it can be between two bones, or between two bones, right? It is a long cleft in a bone, or it can be between two bones also. So we have foramen, canal, and fissure. In the perforations, we have bony depressions, pit, fovea, fossa, groove, sulcus, notch. We have bony depressions, line ridge, crest, tubercle, tuberosity, trochanter, epicondyle, spine, stylet process. And we have the articular parts where we have head, condyle, trochlea, capitulum, and facet. I hope, yes, the adductor canal, the cranial foramen, the foramen ovale. Yes, guys, these terms I will be using in the future, and I hope all these parts are clear. All the bony markings are clear to everyone. Just give me a thumbs up, guys. This, if you guys have understood this, I'm telling you the upcoming lectures in the upper limb will be more easy to you. It will be like a piece of cake. So every time I always advise you guys to know, go with the basics. Right? Understand the things. Anita, very good. Sheena, very good. Chaliye. I'm coming to Amina. Are you like, what to say? I mean, come with your real name. बीच बीच में मजे लेने के लिए आ जाते हैं. कभी मैं मसल पढ़ा रहा हूँ तो कभी तुम मतलब कुछ और पूछने लगती हो, कभी ये टॉपिक चल रहा है तो कभी कुछ और. I don't understand. You have so much of time. No, either you do it unintentionally or you do it. Yeah, yeah. I won't delete the video. Don't worry. Now coming on to the next part, guys. That is the yes. That is the ossification. Yes. Now, Nani Karpuk, very good. Ossification basically means the bone formation. The bone formation. I will be discussing it very shortly, guys. The bone formation, and you already know we have two types. So ossification is nothing but the process of bone formation, and it is of two types. Okay, the membranous ossification, the membranous ossification, and cartilaginous ossification. Cartilaginous ossification. Now, you guys already know when I say membranous ossification, guys, you already know the bones are developed. Okay, directly from bones are developed directly from embryonic mesenchymal membrane. Okay, we have a mesenchymal membrane, and through that membrane, the bones are developing. Okay, even this ossification occurs rapidly. Very, very important point that you can note over here. This ossification occurs very rapidly, and yes, it occurs in certain bones, guys. It occurs in certain bones, you already know, which are actually urgently required. Now these bones are urgently required for support and protection. They are urgently required for the support or protection of vital organs, right? So you guys already know these are nothing but the bones of the skull, or the skull bones, right? The skull bones, right? The flat bones also, right? Even some part of the clavicle, right? It is also formed from the membrane. When we talk about the cartilaginous ossification, guys, remember in the cartilaginous ossification, bones are first, okay? Now, here basically the bones are first modeled, okay? They are first modeled in the form of cartilage, in the form of cartilage, remember, and this cartilage, it is replaced by bone tissue. Sabrina, just text me on my Instagram. I will be happier to address it over here. And it is replaced by the bone tissue, right? Now, this process basically occurs slowly, right? This process occurs slowly, and it is all the bones of the skeleton, majority of the bones of the skeleton, right? The appendicular skeleton, right? The appendicular skeleton wala part hai, right? So that is about the membranous and the cartilaginous. The cartilaginous, it is also called as the enchondral ossification. Okay, enchondral. Chondral, what is for? The cartilage. Okay. So cartilaginous ossification, it is also called as the enchondral ossification. Yes, and the cartilage which is responsible for the formation of the bone, it is nothing but the hyaline cartilage. It is nothing but the hyaline cartilage, guys. It is nothing but the hyaline cartilage. So I hope this is clear to every one of you. Just give me a thumbs up, guys, if this is done. Yes, the axial skeleton. Now coming on to the last one, that is the bursa. Yeah, the bursa, definition, sites, functions, and types. Definitions, sites, function, and types. Now let us just try, Sabrina, Sammy boy. Okay, let us just try to understand with this with the help of an example, guys. Now, you guys already know that there are two bones over here, right? There are two bones over here, bone 1 and bone 2, right? Let us just try to understand the term bursa over here. We have bone 1 and bone 2. And in between, you already know we have, there is a joint cavity over here. Okay, there is a joint cavity. And guys, you already know, yes. So, bursa, if we talk about the definition, guys, if we talk about the definition, remember it is a close flattened, it is a close flattened sac of synovial membrane. सैक का मतलब क्या होता है? बोरा, ऐसा सैक, ऐसा फ्लैट सैक जिसपे क्या भरा हुआ है? Synovial fluid. It is a close flattened sac of synovial fluid. It is a close flattened sac of synovial. Better write it like this. It is a close flattened sac of synovial membrane filled with synovial fluid. Okay, filled with synovial fluid. फिल्ड विद साइनोवियल फ्लूइड. ओके, एक बोरा है जो किसका बना हुआ है? साइनोवियल मेम्ब्रेन का, और उस मेम्ब्रेन के अंदर क्या भरा हुआ है? साइनोवियल फ्लूइड, राइट? नाउ अपार्ट फ्रॉम दैट गाइस, इट हैज द शेप एंड साइज ऑफ कॉइन, shape and size of coin, chiller coin, right? The normal coin, right? It is just like the shape of that, right? Now what is the function, guys, right? This, okay. Now, where it is found, guys, let us just first discuss the sites also. The sites also. You guys already know the sites. Basically, the bursa occurs in close relation to joints. Okay, it occurs in close relation to joints. So that's why I've drawn bone 1 and bone 2, right? Close relation to joints. Okay, and guys, remember they can also communicate between the joint cavity. ये जो बीच में joint cavity है, it can also communicate over there, right? So that is about, you guys have to know, right? Apart from that, what is the function of this bursa? What is the function of this bursa, guys? You should know. They diminish fraction, or let me just write like this. They diminish friction. They diminish friction, right? Between the rubbing surfaces. Between rubbing surfaces. So उनका काम क्या होता है? What is the function if they are present in the joint cavity as well, guys? So what is the basic function of these bursa? They actually diminish the friction between the rubbing surfaces. They diminish the friction between the rubbing surfaces, right? Now, coming on to the next one, that is the types. Coming on to the next one, that is the types. So the types, the very first one, according to their sites. Remember, beta, the types are according to their sites. हाँ, ठीक है, बिल्कुल ठीक है. Spring hearts. According to their sites, they are classified into. Very first one, you should know, we have submuscular. We have submuscular. We have subcutaneous, subcutaneous, subtendinous, subtendinous, yes, and interligamentous, interligamentous, interligamentous. We have submuscular, subcutaneous, subtendinous, and interligamentous. Now, when I say submuscular, guys, when I say submuscular, let me just try to highlight over here. Let us suppose if I'm just trying to draw it, guys, like this. This is the bone and this is the muscle. This is the bone and this is the muscle. Let us suppose that this is the muscle, guys. This is the muscle. So submuscular means it is present under the muscle. It is present under the muscle. It is just like in the form of a coin, and you can very well see, yes, it is just like this. So this is submuscular bursa. Submuscular bursa. It is the submuscular bursa. So submuscular, it is present. Yeah, between it is present between muscle and bone. It is present between muscle and bone. Subcutaneous. Now guys, you already know subcutaneous. It will be present under what? Yes, subcutaneous will be present under the skin, right? Subcutaneous will be present under the skin. Now guys, you already know we have a bone outside this muscle and that is called as the patella. This is called as the patella. Now patella, it is a bone. Yes, yes, the bone and the skin. Yes, Sabrina, very good. The bone and the skin. And outside the skin, yes, yes, outside this patella, outside the bone, we again have these bursa, okay, in the form of a coin, and it is, yes, covered with the skin outside. We have a skin outside. Yes, this is the skin. So in between the skin and the bone, that is the, yes, that is the subcutaneous. So you should remember this is the subcutaneous bursa. Subcutaneous, very good. So it is between the skin and bone, right? Between the skin and bone. Now, when I say subtendinous, guys, it is between tendon and underlying structure. Now, this underlying structure can be anything between tendon and underlying structure. Okay, this underlying structure can be anything, right? Now, let us suppose that this is the tendon guys over here, which I'm just trying to draw over here, right? Yes, which I'm just trying to draw like this. Yes, this is the tendon, right? So it can be between, yeah, we have the tendon wala part over here, right? So it can be between the skin and the tendon, okay, or it can be between the tendon and the bone. It can be between the tendon and the bone. So between the tendon तो रहेगा ही बीच में, तो tendon के आगे क्या skin है और tendon के पीछे क्या है, bone है. So it can be vice versa, right? And interligamentous guys, interligamentous, it is basically between two tendons, okay? So it is in between the two tendons, interligamentous. So that is about the bursa, the definition, size, functions, and yeah, the types, right? So we have discussed the bursa, we have discussed the ossification and its types, and we have discussed the bony markings, right? The features of the bone, the articular, the bony elevation, the bony depressions, and the perforations, right? So I hope today's lecture it is clear to everyone. Yes, today's lecture it is clear to everyone. So yes, we will be meeting tomorrow, and please let me know what. Yes, yes, it is all for the no. I didn't need UG. Sure. Let me know what topic you want me to start next so that I can plan accordingly. Just let me know in the comment section. Please share the video. All the 7 lectures are completed for general anatomy. And I hope you have taken something from these 7 lectures, which will help you in the future upcoming when you will know study all this anatomy and everything, right? So yes, sure. Okay. Goodbye, guys.